Good morning, everyone. My name is Arvin Shen, and I'm a fourth-year UC Davis student and the pre-medical coordinator here at the 12th Annual Pre-Health and Pre-Medical Conference. I'd like to start off by thanking AAMC for sponsoring this event and providing everyone access to these videos online. I am privileged to announce that our next keynote speaker is Dr. Robert S. Juhasz. Dr. Juhasz started off his path at Kansas City University of Medicine and Biosciences College of Osteopathic Medicine. He completed his internship and internal medicine residency training at what is now South Point Hospital. Dr. Juhasz is an American Osteopathic Association board-certified internist who is now the president for the AOA, an organization that promotes public health, encourages scientific research, and serves more than 104,000 professional osteopathic physicians and medical students. He is also the president of South Point Hospital, as well as the former medical director of the Cleveland Clinic Willoughby Hills Family Health Center. As a medical educator, Dr. Juhasz served as the Associate Dean of Ohio University Heritage College of Osteopathic Medicine, Cleveland Clinic Extension, where he was named an honorary alumnus and awarded the Phillips Medal of Public Service. He is also the Assistant Clinical Professor at the Cleveland Clinic's Lerner College of Medicine at Case Western University in Cleveland. Please join me in welcoming Dr. Robert S. Juhasz.
Good morning. Well, it truly is an honor and pleasure to be with you this morning. And I know there's many students here, and I know also that there's advisors that are here as well. And I know many of you already know the career path that you're interested in, and some of you may still be trying to discern that. And I applaud you in that, because certainly all of us have been there at some point and remember that fondly. And I think to the Dean's comments, you know, the importance of being resilient and adaptable are so important as you go forward throughout your discernment, but also through your career. I want to applaud you for being here and attending this conference and really immersing yourselves in these experiences, because I think through the interaction with mentors and with people that you can ask questions of, it hopefully will help you as you make some of your decisions, and also help you as far as some of the knowledge that you will need to alleviate some of your concerns, but also give you the opportunity to find out some of the information that you need. You know, for myself, and you'll hear stories from us because they are so important to our journey. For myself, I was a first-generation American. I had 50 cousins, none of whom had gone to college, and so I was the first to go to college in my family. So I really didn't have too many people to ask about, well, where do I go to school? You know, what's going to happen? How do I apply and do those kind of things? And so it was really inherent. I fortunately had two excellent high school teachers who happened to go to John Carroll University, where I did my undergraduate training, and pointed me in that direction, which at that time John Carroll University had a 100% eventual admission to medical school, and that's really what I wanted to do. I wanted to be a physician. But the way that I got there was sort of interesting. I started working a work-study job when I was 16, and happened to be at a hospital. And I really, it was at that time there were osteopathic hospitals, and this was an osteopathic hospital. And so I started to learn about the way that the doctors and really all of the caregivers in that facility worked as a team to take care of patients. And I was really impressed and thrilled by the way that they worked together in a way to take care of people, not problems. And so I said, that's the kind of doctor I want to be. So I really had the opportunity, you know, as I was coming out here and thinking about this conference, as a pre-med, to put on a program much smaller. And so I'm very impressed with what you all have done and the great work all of the volunteers have done. But much smaller, of about 75 pre-meds from 4 universities, just to really learn more about osteopathic medicine. And I think the opportunity to do things where you have the opportunity to ask questions and get more information is so helpful. So interestingly enough, as I trained as I worked in this hospital to help put myself through my undergraduate training, I ended up going away to medical school and coming back to that hospital to do my internship and residency training, and then went out into practice. And I practiced for 12 years in private practice. I had a National Health Service Corps commitment, which helped also to pay for my medical education. And then practiced as a internist in a hospital, and also ran a residency program. And then about 18 years ago, became part of the Cleveland Clinic Foundation, and had the opportunity to continue to do my work there. And then after 27 years of practice, last year became president of the hospital where I trained. So you never know how that journey is going to spell out, but it really has been a tremendous opportunity and ability to do that. So I would say for you as students, I think the key part as you discern what it is that you want to be doing is really to follow your passion. And it's important to know the direction that you want to head in, follow that passion. But it's also important to have good mentors. And in doing so, it's helpful to seek out people that you either find intriguing from the way that they practice or from the standpoint of their accomplishments, and it depends on which direction that you want to go. But it is helpful to have those mentors to continue to move forward. For me, osteopathic medicine became a passion as I saw those caregivers and those physicians practicing within that hospital, where now I have the opportunity to help direct the care there. And osteopathic medicine is one of the fastest growing professions in the United States. And so it's been sort of on an exponential growth curve. Many of our graduates, about 40%, do train in specialties. And many of them practice in academic medical centers, some of the most prestigious academic medical centers throughout the United States. About 60% of the profession remains in primary care. And at a time when many are saying that we have a significant shortage in primary care, we have been recognized for filling that need. And so primarily in family medicine, internal medicine, pediatrics, and OB. And those physicians continue to practice in communities. Much of our training and our graduate medical education programs are in community-based settings. And being such, when we bring people from the community, train them in the community, they have a tendency to stay in the community to practice. And so particularly as it relates to a growing need in some of the suburban areas, but also in urban areas, and many of the areas that are rural sites, we've been able to make a difference in redistributing some of the workforce and some of the physicians to those areas to practice, and in areas where people have a fondness for where they grew up and where they wanted to serve the communities that they came from. So we continue to do that. Many of our well, first of all, we have about 104,000 osteopathic physicians and medical students, about 80,000 practicing osteopathic physicians in the United States, and 1 in 5 students in medical schools are in an osteopathic medical school. We represent about 10% of the total physician workforce. We have 30 colleges of osteopathic medicine and 40 locations, and many of those are in underserved areas. So we have schools in Harlem, we have schools in Appalachia, we have schools in places like Mississippi or in Tulsa, Oklahoma. And all of our schools are arranged in osteopathic postdoctoral training institutes. So any of the graduate medical education programs are attached to one of our medical schools, even though they may be geographically distributed. For instance, in a state like Oklahoma, you have programs that are certainly in areas that are not in large hospitals, but are connected. And each of our graduate medical education programs connect to the university program through long-distance learning and opportunities to do development. So we have about 5,000 graduates per year, and our enrollment continues to grow. We've had over 13,500 applications to the ACOMAS application service this year for next year's slots. And many of the students that come to our osteopathic training programs are drawn to an osteopathic philosophy that is patient-centered and really is focused on the basic tenets of osteopathic medicine, which says that you take care of people, not problems, that we have a mind, body, spirit approach to care, that the body has a tremendous ability to heal itself if given the proper nutrition and exercise, and that structure presupposes function, in that if you can get the substances within our body to the places where they need to go, that it can do tremendous good to promote healing. And so it's really taking those pieces and really using those together to put together a plan for care in taking care of people, not problems. So we continue to grow. We're younger. Our profession is, the average age is 44. We're more diverse, and we're located in areas where there's areas of need. And so from that perspective, we continue to meet the needs of the future. And, you know, our basic premise has been really to improve care and use our unique contributions in the way that we provide care to make a difference in the communities and also in any of the centers that we practice in. So I think really to close a couple things, really I would say that you know, it's important for all of you to continue to be passionate about your seeking your knowledge and where the type of medicine that you'd like to practice. It's important for you to look at all aspects of the opportunities within medical care to do that. I'd continue to take advantage of courses or conferences like this to help educate yourself and continue to do that. And I also continue to speak to the Keynote physicians and any of the mentors that you can find. For the advisors, I think it's important also for you to make sure that you also are able to guide students from the standpoint of all of the opportunities that they have in their education, and if there's a gap, to make sure that we're reaching out to help with the education of our advisors to do that. I know that when I applied, when I was applying only to osteopathic medical schools, my pre-medical advisor said, "You're doing what?" and it really provided an opportunity to really help do some education for those pre-medical advisors about the care and the practice that we provide. This past year, we've been on a journey actually to take our graduate medical education system and create a single accreditation system with the Accreditation Council of Graduate Medical Education. And so all residency training programs throughout the United States will be on a similar platform. And for those programs that are osteopathically recognized, they would also have those osteopathic tenets embedded within those standards for those programs. So I would close with a quote as well. And it's a quote by Steve Jobs, and Steve Jobs, and he said, "The only way to do great work is to love what you do. If you haven't found it yet, keep looking. Don't settle. And as with all matters of the heart, you'll know when you find it." Thank you, and enjoy the rest of this conference.